The Canada Health Act, CHA, is a federal law that establishes the principles and conditions under which provinces and territories receive funding from the federal government for healthcare services. It ensures that all Canadians have access to medically necessary hospital and physician services without direct charges at the point of care. Enacted in 1984, the CHA was introduced to consolidate two earlier healthcare acts, the Hospital Insurance and Diagnostic Services Act and the Medical Care Act. Its primary purpose is to protect and strengthen Canada's publicly funded healthcare system by preventing extra billing and user fees. The Act establishes 5 fundamental principles that all provincial and territorial healthcare plans must meet to receive full federal funding through the Canada Health Transfer. Each province or territory must manage its healthcare insurance plan through a non-profit public authority. This public authority must be accountable to the government and subject to audits. Private companies cannot administer the core healthcare system. The plan must cover all medically necessary hospital and physician services. What qualifies as medically necessary is determined by each province or territory, often in consultation with medical professionals. All eligible residents of a province or territory must be covered on equal terms. No one can be denied healthcare insurance based on age, income, or pre-existing medical conditions. A resident moving from one province to another must continue to receive basic healthcare coverage. If a Canadian is traveling within the country, their home province must cover necessary hospital or physician services. Canadians traveling abroad may receive partial reimbursement for emergency medical expenses, but coverage is limited. Healthcare services must be provided without financial or other barriers. This means no extra fees for insured services and no discrimination based on factors like geography, income, or age. Provinces must ensure reasonable access to healthcare facilities and professionals. The CHA only guarantees coverage for medically necessary services provided in hospitals and by doctors. These include doctor consultations, hospital stays and surgeries, diagnostic services like X-rays and lab tests, and some mental health services provided in hospitals. However, the CHA does not define what is medically necessary. That is left to each province and territory. The CHA does not require provinces to fund services outside of hospitals and physicians' offices. This means prescription drugs, dental care, vision care, home care and long-term care, ambulance services, and private clinics charging fees. Some of these services may be covered partially or fully by provincial territorial health plans or private insurance. The federal government enforces the CHA by controlling healthcare funding through the Canada Health Transfer. If a province or territory violates the Act, the federal government can reduce funding or withhold funding until compliance is restored. For example, in 2018, British Columbia was penalized for allowing extra billing in private clinics. Quebec faced penalties for user fees charged for diagnostic services. Although the CHA is a federal law, healthcare in Canada is delivered at the provincial and territorial level. Each province and territory administers its own health insurance plan, determines which services are medically necessary beyond those required under the CHA, and funds additional services like prescription drugs, home care, and dental care based on local policies. Examples of provincial programs include the Ontario Health Insurance Plan, British Columbia's Medical Services Plan, and Alberta Healthcare Insurance Plan. Each plan meets the CHA's 5 principles, but may differ in how additional services are covered. The Canada Health Act ensures that all Canadians have access to essential healthcare services regardless of income, prevents privatization and extra billing in core medical services, and maintains a single-payer system where the government funds healthcare rather than individuals paying out of pocket. However, some challenges remain, such as wait times for medical procedures and specialist appointments, unequal access to services, especially in rural and remote areas, and debates on privatization, with some provinces allowing private clinics for non-insured services. The Canada Health Act is the foundation of Canada's universal healthcare system. By ensuring publicly funded, comprehensive, and accessible care, it guarantees that all Canadians can receive essential medical services without financial barriers. However, the Act does not cover all healthcare services, and there are ongoing discussions about how to improve and expand coverage. Thanks for watching.